The essence is the same, whether you're treating it with surgery or treating it with the laser. What you have to do is get rid of the diseased tissue, get rid of the bacteria, get rid of the tartar, and make the pocket shallow. So when you do cut and stitch gum surgery, we're opening the gum, we're scraping out the bacteria and the tartar, and we're putting the gum back many times higher up on the root, so there's more root exposed, but the pocket is shallow. The laser is doing the same thing in a different way. The laser energy is killing the bacteria, it loosens the tartar from the teeth so we can remove that, and then you go back in with the laser on another setting, and the laser, in effect, heats the blood and connects the gum back to the root of the tooth. So after you treat someone with the laser, you don't have all the recession that you have typically after conventional periodontal surgery. You don't have the cold sensitivity. And those are the things people always complained about long term.
So with the old, one of the drawbacks with that root planing or that scraping and cutting procedure is they may end up with cold sensitivity.
Exactly.
So why does a laser that doesn't happen so much?
Because after traditional periodontal surgery, there's a fair amount of recession of the gum. So either we intentionally move the gum up, or because we've reflected the gum from the bone, exposed the root, taken away some diseased tissue, there's more root exposed. With the laser, we're not lifting the gum off the bone. We're not cutting away, big pieces of diseased tissue.
So the root is sensitive.
The root's very sensitive.
So if you have cold sensitivity, meaning fluids are leaking into that direct root, you have a problem.
Yeah, it's very sensitive.
Interesting.
Many people, won't eat ice cream, won't have cold drinks, and they suffer with it again because they wanted to keep their teeth.
But because the gums have
reconnected to the tooth.
Okay. And if it's cold, I'm sorry, if you have cold sensitivity, the gums have kind of moved away from
the gums have receded. They've moved up, or they've exposed some of the root, so that now it's more sensitive. But that can be
stopped. I mean, it's simple. I mean, it's just early treatment. Is that the key? I mean, if you see bleeding gums, go in.
Right. Most people, because they think bleeding gums is normal, ignore bleeding gums. And then it festers until eventually people have bone loss around the teeth. And then either they realize they have a problem or they go to their dentist who tells them they have a problem. And by that point, they have bone loss around the teeth, they have deep pockets, and that whole cycle of destruction has started. To me, this is a very holistic treatment almost, because really what are we doing? We're removing the bacteria that's causing the problem and then letting the body's own systems take over to reconnect the gum back to the tooth and restore health.
So no more bleeding gums in this case?
No more bleeding gums, no more bad breath, and the beauty of it is it happens so quickly. It's not weeks and weeks of visits, it's not multiple visits. It's a couple visits and people are treated.
Well, logically it definitely makes sense, and I'm not trying to side with you too much, on this. And people need to know that this is a real interview. Nobody's reading scripts. We didn't rehearse this, but it seems like that if anybody has this problem, they should go in and get it done by a laser. Period. I mean, is that your thoughts?
Well, that was the conclusion I came to as well, and that's why I got involved with the laser. It's really been a revolution to my practice for a few reasons. First, I've always tried very hard not to do periodontal surgery, because for myself, I wouldn't want it if I needed it. So we would do scaling. Anything non-surgical that seemed like it worked, I would investigate and try to use to the extent possible. And I think over the years, patients really appreciated coming to my practice because I wasn't very quick to take out the scalpel and to do gum surgery. But the flip side is that if you don't treat gum disease sufficiently, it's not enough. Some people would say, well, I don't want the surgery, I just want scaling. Just scale my teeth and don't do anything else. And
do they tell you that?
Some people would, and you have to respect them. That's what they're choosing. But they would have a false sense of security because they were treating their disease insufficiently. And if you treat it insufficiently, ultimately it's going to fail. They're going to lose their teeth anyway. So to me, the beauty of the laser is that they could have their cake and eat it too. We could treat it, we can get rid of the pockets, we can regrow some of the bone they've lost around the teeth without them having to go through surgery and all that that entails. And I think people really appreciate that. And the proof is in the pudding because so many patients come from other patients who've been treated this way. Everybody talks, and I see the results every day, both in terms of patients coming back after treatment saying, wow, that was a breeze, I'm so glad that I did this.
So pain is not something they complain about, really?
They don't. In fact, I've had a number of patients, Randy, who had conventional periodontal surgery years ago. They broke down again, they needed periodontal treatment again. So these people are the perfect controlled experiment. They've had conventional cut and stitch periodontal surgery and they've had laser treatment. And without exception, they say, that laser was a breeze, I would never do that other kind of surgery again. This was simple, and it is simple. You're anesthetized, you sit, you have it done, and afterwards there's really very little downtime.
So how soon before they see results after the treatment?
The results are almost immediate. People come back a week later and already they're saying, boy, my gums don't bleed anymore, my mouth feels great, and the effect on their body is immediate as well. I'm going to tell you two fast stories.
Okay.
As a lot of people probably know, gum disease affects diabetes. So people who are diabetic, number one, are more at risk for severe gum disease. And diabetics who have severe gum disease, their need for insulin or diabetic medications is higher, because gum disease is a chronic infection, and chronic infections drives up someone's blood sugar. I had a patient a few months ago who was on an insulin pump, and he had tremendous periodontal disease, hadn't been to the dentist in 20 years. I treated his dad, and his dad referred him to my practice, and he used to have to put a new vial of insulin in his insulin pump every 3 days. We did his laser treatment, and he was in last week for a quick check, and I said, just out of curiosity, are you using less insulin? He says, you know, a vial of insulin lasts me 5 days now. Think about how his overall health has improved because he's treated his periodontal disease. It's really fantastic. And the other thing we see sometimes is, you know, when people have tremendous gum disease, you know, it's a chronic inflammation in the body.
So it is a chronic infection? You called it an infection. Is that what it is?
You know, when people think of infection, they think of, you know, a big abscess or something, a toothache type thing. It's really a chronic inflammation, and the body is constantly mounting this immune response to try and get rid of the bacteria, but it can't get rid of the bacteria. So if you ever had the flu, you know that when you're sick, your body's fighting this massive war against what's invading your body. You have no energy at all.
Good point.
So many people who have severe gum disease, after their disease is treated and their body doesn't have to constantly fight this infection, they just feel like they have more energy.
Wow.
I've never read
makes sense.
I've never read a study on it, but I've had so many people tell me, I just feel better, I have more energy. And you know, sometimes I think some of that is also because of how they feel about themselves. That they don't have the worry. Most people who have this problem worry about it, worry about what's going to happen if they don't treat it.
Wow.
So that's constantly on their mind. Their breath is always on their mind. It's like that worry is just cleared off their plate and they can go on with things. They can smile, they can eat, not bleed. They don't feel bad every day when they brush their teeth and they spit into the sink and they see blood. And I think part of their feeling better and having more energy, aside from the biologic part, is just the psychological part of, boy, that's done. I don't have to worry about that anymore. I'm going to keep my teeth. I'm going to have a nice smile. I don't have to have dentures in the nursing home. I don't have to limit what I eat. I don't have to be embarrassed kissing my favorite person I like to kiss. They just feel good again.